Cancellous autograft is recognized as the gold standard for bone grafting based upon its osteogenic, osteoinductive, and osteoconductive properties. However, harvesting cancellous bone has become an overlooked or forgotten art due to perceptions associated with higher risk grafting devices, unreliable graft capturing mechanisms, prolonged surgical time, and donor site morbidity. The all-in-one COREX percutaneous harvesting device solves these issues by optimizing cancellous dowel extraction while minimizing alteration of innate graft architecture, time-consuming procedural steps, blood loss, and post-op pain. Unlike alternative harvesting systems, the COREX is a sterile-packed, single-use device that doesn't require accessory instruments, setup, or disassembly to retrieve graft product. Does not require soft tissue retraction or periosteal stripping. Has a minimal learning curve and can be mastered after only a few cases. Employs design features such as a fluted trocar tip and shoulder stop to limit the depth of cortical breaching. Captures graft with a castellated and chamfered trephine tip, which enables auditory and tactile feedback during cancellous microfracturing while reducing the risk of sidewall penetration. Can harvest enough autograft for many 1 and 2 level fusions using multidirectional passes from the same 7 or 9 millimeter window. Can limit post-harvest bleeding via gel foam backfilling. Has several CPT codes associated with common harvesting sites. Ensures a reliable harvest with its simple graft locking mechanism that captures cellular elements in their naturally occurring ratio and orientations. Does not require any power or suction, thus avoiding thermal osteonecrosis or excessive bleeding from the effects of negative pressure. Does not unnecessarily morselize innate trabecular architecture or dissociate mesenchymal and myeloproliferative stem cells from their original matrix locations, which numerous studies have shown enhances bone graft performance. Ultimately, the COREX was designed with a paramount concern for patient safety and simplicity of operation, resulting in ease of use through its all-in-one design and surgical efficiency, while making every effort to preserve graft functionality through minimal cellular and matrix disturbance. The COREX device has been employed in more than 30,000 bone harvesting procedures to harvest graft from the anterior and posterior iliac crest, proximal and distal tibia, femur, and the calcaneus for over 15 years without a single FDA-reported surgical complication. Consider using the COREX bone graft harvester in your next bone graft procedure.
Trinity Orthopedics is proud to introduce a crucial evaluation program for the COREX minimally invasive bone harvester, an innovative device designed to redefine autologous bone grafting by eliminating the long-standing challenge of donor site morbidity. We are inviting a select group of leading surgeons to participate in a multi-center, 20-patient evaluation designed to assess graft quality, ease of harvest, and donor site morbidity. This study is not about evaluating fusion rates. Those are already validated by more than a century of clinical data confirming that autologous cancellous bone remains the most biologically effective and reliable graft material available. For this evaluation, surgeons may choose the harvest site that best aligns with their typical workflow, whether it's the posterior iliac crest, the anterior iliac crest, or the proximal tibia. The COREX system provides consistent, minimally invasive access to high-quality cancellous bone across all 3 anatomical sites, allowing you to evaluate its performance in the context most relevant to your practice. We also encourage surgeons to experience the proximal tibia, an often underutilized site that offers abundant cancellous bone, straightforward access, and remarkably low morbidity. It's important to remember that not all autologous bone is equal. Many spine surgeons rely on what's available locally, crushed cortical fragments from the lamina, spinous processes, or facet joints, believing it to be sufficient autograft. But local bone is primarily cortical, often mixed with soft tissue and cartilage, and lacking the trabecular network and viable marrow cells that make cancellous bone uniquely osteogenic. It is not the same biologic material, and it does not behave the same way. Cortical fragments can serve as structural extenders, but they do not drive osteogenesis like living cancellous autograft. Many surgeons also believe their fusion rates are consistently high, but when rigorously measured, the picture changes. Thin-cut CT imaging alone can overestimate fusion success by up to 30%, and planar pseudarthroses often go undetected unless stressed or surgically explored. Even in the cervical spine, studies have shown that when patients believed to be fused were examined intraoperatively, solid fusion existed in only about 70% of cases. These realities underscore why true cancellous autograft remains the benchmark for biologic certainty, and why reintroducing it through a minimally invasive technique is such an important step forward. We also recognize that many surgeons have adopted synthetic and cell-based matrices for convenience. While these materials may be widely used, they cannot replicate the living, osteogenic and osteoinductive environment of native cancellous autograft. They may fill a void, but they don't regenerate bone in the same way. Now, with COREX, you can reintroduce nature's gold standard into your practice, with none of the morbidity that once made it inconvenient. Your participation in this program carries both clinical and academic value. You'll be contributing to data supporting a multicenter white paper and potentially a peer-reviewed publication, with full acknowledgement of participating surgeons. Participating surgeons will receive a fair market value honorarium of $3,500 to $5,000 for completing post-procedure questionnaires and providing detailed feedback. This is not for surgical services. Your operative time remains billable under standard CPT codes 29000 or 2902, ensuring full compliance with ethical and regulatory guidelines. Trinity Orthopedics will assist your facility with all documentation and approval requirements. Upon confirming your participation, our team will coordinate logistics, training, and onboarding to make the process seamless. To support your benefit for using the COREX bone harvester at your facility. COREX has been shown to be approximately half of the facility cost versus a cellular-based matrix or synthetics, plus the added benefits of increased efficacy due to optimization of the intraoperative effort and reduced risk of disease transmission from cadaveric cellular allograft donor in the absence of a potential immune response. Your insight will directly help advance the field of minimally invasive autograft harvesting, reaffirming the biology for true foundation of lasting bone regeneration. COREX, the gold standard. Made simple. Trinity Orthopedics. Find us on the web at trinityorthodevice.com.